From Rectangle Health, this is the Modern Practice Podcast, a show that provides you with fresh perspectives and practical advice from industry experts in the ever-changing world of healthcare technology. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado...
Hello, everybody, and welcome back to the Modern Practice Podcast. We've got another great episode in store for you here today as we welcome Zed Williamson, CEO, founder of Trackable Med, and host of the Physician Growth Accelerator podcast, back to the show. If you missed part one of this mini-series, Growing Pains to Growing Gains with Zed, check it out. It's a must listen. I'll have that episode linked in the description of this one so you can go tune in and catch up. Just a little bit of background on Zed. For over 10 years, he and his team have empowered practices to achieve their growth goals, leveraging expertise in neuroscience. Zed shared his insights into transforming the mindset of each staff member to focus on growth with purpose. Zed speaks to the importance of hiring the right team members, enabling them to achieve their objectives with the right tools and level of support. I'm excited to continue this conversation today and dive deeper. And without further ado, Zed, thanks for taking the time and welcome back to the show.
Thanks, Gary. Excited to be here.
Absolutely, as am I. And let's get right into it. As I personally prepped for this conversation, I was on the Physician Growth Accelerator site, looking through your unique process of helping practices hit their growth goals. And something that really sort of stood out to me is business does not exist in a vacuum. The decisions you make or don't make, and I'm quoting this, impact everything regarding the health of your practice. Can you touch on that, expand on it, what it means? And for someone that visits your site and reads that, what are the gears you're trying to get turning there?
Sure. It's a really interesting thing that our brain does. Our brain wants to keep us comfortable at all times. Mm-hmm. And it is designed for this idea of first order consequence. And so if there's anything uncomfortable, we tend to avoid it or we tend to Band-Aid it. And in reality, anything you're dealing with in your business right now is the perfect outcome of your current entire system. And so the reason we focus on this idea that these things don't exist in a vacuum is because every action or lack of action is part of your entire system. So let's say you're frustrated with a high no-show rate of patients. It's not because just simply these patients don't want to come to the appointment. It's because of probably 9 or 10 steps leading up to the fact that that patient has an appointment. And that's what so commonly gets missed is, well, you know what, we need to get a credit card on file. And then if they miss that appointment, we're going to charge them, and
crack the whip. Yeah.
That's not the deal. The deal is there's about 8 things that probably happened that is perfectly creating your current no-show rate. If you have high turnover, there's multiple parts of your system that's creating high turnover. If you have frustrated employees, unhappy patients, those are all perfect outcomes of the current system. And the mistake that so many businesses make is, let's go tackle this one individual thing. Let's speak about it generically so that we can never actually measure that we did anything, because that's what keeps us comfortable. Yeah. And that's the idea, is we want to dig in, bring awareness and clarity to the entire system so that you can see all the pieces.
Yeah, super interesting. And I want to quickly follow up on that. So in these discussions, as you identify a problem and you mentioned, there's 8, 9, 10, maybe more steps leading up to that outcome that exists today. What are some of the most common issues you're finding? And what are those most in those steps prior to it, the common decisions that you notice practices are avoiding making or avoiding talking about even because of that discomfort?
Yeah. So the first part of that question, it's usually they're witnessing something they don't like. And let's go straight to the idea of collections.
Sure.
So they have an opinion about how much they collected in the month of May. And maybe they don't like that dollar amount. And they actually think that the collections in May is from the work done in May. And so then they have an opinion about how good or bad we did in May. But that's not how medical businesses work. So what you tend to find is if you dig in, that the work that actually created collections in May happened over the past, 5 to 6 months sometimes. We're working with a practice and they were excited about their April. They thought that their April was pretty good and thought maybe that they didn't have any issues, but their upcoming May wasn't looking as good, quote unquote.
Right.
And I'm using that generic term purposely, and I'll explain why in a moment. But we did a deep dive, and this is a practice that does in-office procedures. And the average gap in time between the first patient appointment and the date of the procedure was 179 days. That was
Wow.
the average.
Wow. Okay.
So not only could they potentially be avoiding a decision, they're also making decisions on bad data.
Right.
Because you didn't create April in April. You created April 5 months ago. And so if you want to pat yourself on the back for the work you did 5 months ago. But let's say you don't like the month, you could potentially be changing something that's working because you're experiencing something from 5 months ago.
Right.
And that's the idea of the system. And I poke fun at the idea of we did good or we did bad or it's feeling nice or it's, we're too busy or we're not busy enough. These generic terms are basically meaningless.
Right.
So one of the decisions that I tend to see practices avoid is putting down a very specific measurement on what they're talking about. So don't tell me you're too busy. Tell me define that for me. What does that mean numerically? Don't tell me it takes too long for a patient to have a procedure. Tell me how many days is too long. And what that does is that creates simple math equations for practices, and they can start building their systems to purposely generate the outcome that they're looking for.
Makes sense. So what about the can you touch on the qualitative things that, decisions should be made on that you can't necessarily, or maybe you can, measure. So I'm talking, if the goal is to increase foot traffic through the practice's door, treat more patients. Let's look at, let me think of an example here. More on the qualitative side. Happier staff. How do you back into those steps, those 8 steps or however many it is, to build that happy staff, to build that team that's willing to welcome and excited to welcome more patients to the door, excited for that Monday morning?
Sure. Yeah. So it's interesting what you bring up. Let's say the practice has a goal of getting to 30. I'm just using a random number for easy math, 30 new patients a week. And the leadership of the practice is like, oh yeah, 30 would be good. We like 30. We got to get 30.
Yeah.
What does the staff believe about 30? Is it possible in their eyes? Is it painful in their eyes? And if the staff doesn't believe it's possible, guess what? They're going to prove it to you.
Yeah.
You're not hitting
Yeah.
30. If it's painful, guess what? They're going to avoid it.
Yeah.
And that's when you have that, it's a mismatch and the math just actually doesn't work.
Right.
And so what we suggest is diving into what are the measurements to actually achieve these numbers leading up to it. So a process that we teach is we design failure. And it's one of my most favorite things to do with a team. And that is we put it up on the board and we say, okay, let's go achieve 30 new patients a week. And let's get everybody in this room who participates in this process. And we explain why the goal matters. If we just say 30, like we're pulling it out of thin air, you're not going to have any weight with your team. And your team is just going to wait till you stop making it a goal and they won and the practice loses. So why 30? Why does it matter? And so be able to support it. We're doing 30 because of A, B, and C. And it's important to the practice because of this. And it's important to me because of this. That's how you want to speak to these items. And then we get around a circle or in front of a whiteboard and we design failure. So, hey, let's make sure it is absolutely impossible to get to 30 new patients this week. What could we do to create that failure? And at first, you'll get a little silence in the room because they start thinking about things that are obvious. And that's okay. Let's write the obvious things down. No patients want an appointment. Great. Let's write that down. We don't answer the phone. Great. We don't respond to appointment requests. Great. We don't have any availability. Great. And you just keep writing this list and you start looking at this list, and it's so easy to create failure. But what's cool is when you create failure, you actually also created perfect success because you've identified every single barrier between you and this goal. And now you get to go item by item and do the same process. So imagine someone says, we don't have availability. That's great. That would keep you from getting 30 new patients. Now, how can we guarantee that we don't have availability? Oh, and they come up with all these other reasons. And the team starts realizing they're doing some of the items that are designed to hurt. And they're like, gosh, you know what? We do that. Okay. And it's so eye-opening and a very powerful tool to get over those humps.
Yeah, super interesting. And I'm just thinking about resistance from staff. If they're, working an 8-hour day already, and the practice owner or owners just want to keep driving that growth, and the staff are super efficient. They're working hard. They're doing things that are creating great patient experiences, all of the above. But then it's that, I guess, common theme of like, do great work, be rewarded with more work.
Mm-hmm.
How do you tackle something like that where the staff is just like, we feel like we've hit the peak. We really feel like we're pushing the gas as hard as possible. How do you kind of navigate that?
So there's some foundational work that allows you to navigate that. The foundational work is, why are we all here?
Yeah.
And if we're here to be comfortable, and that's the reason for the practice, then maybe those people don't belong in the practice. If the reason for the practice is to help a patient achieve something that maybe they didn't think was possible, when do you limit that? When do we decide that the next patient isn't as important?
Right.
And how is that communicated through our organization? Because if you have that foundational, truly why we do this, you don't get people pushing back on more work. You get people working together to make a machine that can handle more patients, because that's the end. That's the actual shining light that we're headed towards. When you get people pushing back, those are the people who are showing up, clocking in, doing a job. And look, that is the perfect outcome of many current systems right now,
Sure.
of creating a scenario where your team doesn't really know why they're doing the work they're doing.
Right.
And there's a lot of power in them understanding why they are. But so let's say you have a team that's busy and they are super efficient and patients are very happy. Then there's likely measurements in the organization that would help identify when we've gone too far as it relates to our why. So if you go so far that now patients aren't getting good service, now that's going against a foundational existence of ours.
Right.
Now we have to solve for that. And you don't solve it with a Band-Aid. You solve it with some root cause analysis. Let's design failure. Okay, we've decided that 40 is too many for our current system. Let's design failure for 40 and see where all those barriers are.
Yeah.
And is it we need more team? Is it we need different systems? Is it we need technology? And you can see that now you're starting to identify the proper puzzle pieces that are missing.
That makes sense. And I think it's at that point too where sometimes it just comes down to, or has it come down to, you tell me, where you're looking at the entire practice, how they're operating, everybody's on board. They not just bought in, but like have a deep belief that yes, we should treat more patients, and they're excited. At that point, are you running into circumstances where it's like, hey, you need to find another location and staff up there as well. Is that like the perfect situation where a practice is truly ready for growth?
Yeah, when you and it should all be measured and numerical,
Yeah.
instead of, man, we feel really busy.
Yeah.
It's let's identify our true capacity. Where does this system break? We
Mhm.
use terms internally here about let's create a system, let's push some water through it and see are there any leaks.
Right.
And so in these practice scenarios, what is the true capacity? Where are we compared to that capacity? How close can we get to full capacity? And then what does the opportunity of either additional providers or additional locations, what does it do to capacity realistically? And what can we expect regarding how that capacity gets filled? Um, Many times it's unfortunate someone adds a location because the location was the goal.
Mhm.
I hear this a lot where it's like, yeah, I want to have 3 locations. Well, I mean, you could just go open 3 locations and achieve your goal. You could also go out of business with 3 locations. What are we really trying to do here?
Mhm.
And then they realize, well, no, I want 3, you know, good locations. All right, well, what's
Right.
good? Well, profitable. Well, what's profitable? 1 penny over expenses is considered profitable.
Yeah.
Well, okay, I
Is that
want 3
enough?
locations that has a net profit of a minimum of 18%. Now you're talking. So now
Yeah.
you can make a decision that leads to that as opposed to those feelings of we're busy, we should open, I think we could do more, I
Mhm.
think we should do less. These generic terms that our brains talk us into using to keep us comfortable.
Yeah.
Hey, we got to do more, better, faster. Okay, that's completely worthless. What is the definition of that? Because if
Yeah.
you say more to 10 people, 10 people will define more differently.
Absolutely. So if we're checking the vitals, we touched on this a bit in the first episode. Not a bit, quite a good amount. Is the right fit, as whether you're whether you're in one location looking to bring on more staff, because that's gonna back into the 8 steps that lead to that perfect outcome. Knowing when to hire, when to fire. And we'll start with hiring. Last time we spoke, you mentioned, what the question that came up was what would make this the best decision for me, for the person hiring. I'm sorry, the person taking the role, and what would make this the worst decision for both sides. Can we get into that a little bit more? Can you expand? So if someone is seeking a role, if someone is looking for a new position, my assumption is, pay is going to play a factor into it. If that expectation is met, if the skills and experience align, and they don't feel like they have to figure it out on the way, and maybe some people do. If there is that alignment, and I want to talk about the staff specifically, at what point would you say, as you discuss with, let's say, an office manager, hey, this actually, I agree with you, is the right fit. You should consider taking this job with this practice specifically.
Yeah. So you look at what can be trained by the practice, and what can't be trained.
Right.
So many things can be trained. That doesn't mean that the practice hiring has the ability to train them. So you have
Right.
to dig into yourself and say, realistically, what level of absolute skill must someone have for them to be successful here?
Right.
And it's kind of a, if they're not this, we don't even talk,
Right.
because there's no reason. But it's also, you don't hire someone just because of that. I believe, and I think I mentioned this, but I'll just catch everyone up, that hiring is generally broken because you have a scenario where someone wants to be offered a job, and you have someone who has a place that they want everyone to want to work. And so you have this, it's just a bad communication scenario.
Yeah.
So everybody's putting their best foot forward, trying to talk the other person into how great this is. And that's why we have such high turnover. So what is the skill that we can train from? And that's the cutoff. If they don't have that, boom, we don't even talk. But the most important part is to understand, are they going to fit from a culture standpoint? And that's related to behavior. Um,
Right.
as humans, we are in control of our behavior. We aren't necessarily, you know, some people refer to themselves as, well, that's the type of person I am. And that's not really a thing, because the type of person you are is just the things you do, and you have control over that behavior. And so when we look at bringing in a new team member, then we need to make sure that their behaviors that are natural to their existence are going to align with the behaviors that are the values of that specific practice. And then it will be a good fit. The question about what makes this the greatest decision and the worst decision is to help uncover exact expectations, because that also gets lost so commonly in conversations about being hired.
Yeah.
We want to have a bullet point checklist. Here's what I care about. And a year from now, if we're not doing these things, this was a bad idea for me.
Yeah.
Same with the person.
That makes total sense. So if I want to touch on the culture thing real quick. In your eyes, if culture is not built and set up from, let's say, the owner forward, do you feel it will do you believe it'll naturally default into whatever, like, how does it get shaped if it's not addressed, is my question. If
Yeah.
somebody is not coming in and saying, this is what we believe in, this is what we want to do, this is what we want to achieve, if you just leave that element out and hire however many staff members there are in need for that particular practice, how do you see that culture just trying to trickle down and take shape on its own?
It'll be negative.
Yeah.
I mean, I would bet it's a bet Vegas would never take, because of
Yeah.
how completely predicted it is. And it's because we are humans with human brains, and human brains lean towards negativity because it is a survival mechanism. So if we
Yeah.
think the reason we're here today, the reason we can have this conversation, is because thousands of years ago, really, people who were driven by negativity bias, avoiding danger, survived. That's why we're
Mm.
here. So it's pretty built into who we are.
Yeah.
And if you don't set the standards for the culture, then it's going to lean negative, because that is the nature of individuals. And if there is no guidance, then they're just going to fall down to that spot.
Yeah.
And you'll have defensiveness, you'll have drama, you'll have gossip. It's just going to be the case.
Yeah.
You have to take hold and state, what are the behavioral core values that we stand for that are important to this organization? And you have to put that line in the sand, and you have to talk about it all the time so that people are uncomfortable. You want people to be uncomfortable. Uncomfortable is not bad. It is good. We as humans, we talk ourselves into thinking comfortable is good. It is not. The only way you build muscle is through discomfort, through stress. The only way you grow is by getting out of your comfort zone. I was actually just visiting my parents in the San Francisco Bay Area, and my parents are in their 80s and late 70s, and the idea of getting into a driverless car, really freaks them out.
Right. Right.
And so I forced them to do it. And so we got into the car in San Francisco. It drove us around for about 35 minutes. And the amount of joy that both my parents had was incredible. And it wasn't because the drive was that fun. And it's not because the technology was so interesting. It's because they were outside of their comfort zone.
Right.
Your brain notices that when you step outside of your comfort zone, that you are no longer limited. And so as leaders, we need to help our team come, step outside of that box of limitation that we put around ourselves as humans. And that box of limitation will drive a practice culture to be negative if someone is not constantly driving forward.
Yeah, that makes total sense there. So if we shift back, we spoke about the hiring. I want to get to the ugly one, the firing. And when I think about it, has there been an instance, you don't obviously know sharing of specific practices or people, but has there been an instance where you've come on, your team has come on, and you're looking at staff, and you're speaking to the owners and saying, and you hear, I'm thinking about letting this one go or firing this one in particular, and then the outcome changes after you speak to them because it may potentially be a culture issue. It might be lack of technology. They're overwhelmed with something that could potentially be automated at a relatively cheap cost for a solution, on and on and on. The examples could go on forever, but has there been that type of like aha moment or that awakening where it's like, maybe I was looking at this wrong, and then that person gets to hold on to their job, but also is happier at that job once the changes recommend are implemented?
Sure. So the answer to that is yes. Thinking about letting someone go, the first thing that has to come to your mind is, will they be surprised?
Mhm.
If they are going to be surprised, it is 100% your fault they failed.
Mhm.
They can't be surprised. You can't have an organization where you let someone go and they're surprised.
Right.
That is on you every day, 100% of the time.
Right.
If we have organizations where people would never be surprised, guess what? People actually do better.
Yeah.
They perform
It's
at a higher
incredible.
level.
Yeah.
They perform at excellence because it's just about what the expectation is. And it's not about, I'm going to hold these people accountable.
Mhm.
And, because you can't really hold people accountable. People have, we are humans. We are in control of our own behavior.
Mhm.
It's about communication, and it's about setting standards and saying, here's the lanes on the road in which you got to drive between. And so in those scenarios, there's times where someone wouldn't be surprised, but the practices still hold on to someone. And many times that decision is made because they're worried about the rest of the team
Right.
being inundated with workload. And also, here's another bet Vegas would never take. If you let that person go, everyone's going to be excited. You're going to hear words like, finally, it took you long enough.
Yeah.
Can't believe it took that long, And so your concern about everybody being overwhelmed is more likely you dealing with the discomfort of letting someone go. And maybe you think that you let them down because, they weren't right for the position, or they
Right.
weren't given the tools like you mentioned.
Right.
But if you have a team where no one would be surprised and there's clarity around what everyone does and why we do it, then what happens is your team is going to come to you and say, hey, you know what? I think we could bring in this piece of technology and I could be more efficient at my job.
Right.
Or, hey, you know what? The math doesn't work. It takes me 5 minutes to do this task, and I've looked at all the ways to speed it up, and 5 minutes is the fastest, and it needs to be done 100 times a week. And with these interruptions that I get because of where my desk is, the math just doesn't work. And so
Right.
now you're solving for these things, and people appreciate it. So when it comes to letting someone go, first thing, are they going to be surprised? You have to make sure they're not surprised. That's on you. Then, if we're open about, what people are there for, they will work with you. They will be proactive. So many leaders complain to me about team members not being proactive, and I got to tell them to do everything. It's like, well, you're probably right, and you probably created that. You're experiencing the perfect outcome of your current system.
Yeah.
What would happen if they made a decision on their own? What do they believe would happen? Are you in a position where they feel like they have to ask you everything? Are they a personality profile that has to ask someone everything? We use Predictive Index for our clients and for us, and there are different profiles. And if you have a profile that is built to be very collaborative and highly detailed with very little openness to risk, if you are not clear with that person about what they are there to do, they are going to ask you 100,000 questions. And it's because they should, because that's what their personality profile needs.
Right. So there are obviously multiple personalities. Some people just need constant feedback. Some people fear, if they take a job and they're asked to do something that falls within the scope, and it's just a little bit of a different process from their previous employer, what have you, whatever the case may be. You have that person that'll be proactive and come get the answer, but you also have someone that's might be fearful. How, just kind of going back real quick to the hiring, how important is it for the owner or the hiring manager, we'll call them, to vet that part out? Is it important to have that wide dynamic of different personalities, or should the hiring manager really say, like, this person just came after me with questions during the hiring process, really nailed down what they really nailed down their understanding of the job scope. That's the person I want. Or is that not so much a priority during the hiring process?
So I'm a fan. So we use predictive index in hiring
Yeah.
as well. And it's not to judge whether someone should be hired or not.
Right.
It's to help you see around the corners.
Yeah.
So if someone is very collaborative, it's going to be very difficult for them to make an independent driving decision, and they require a ton of precise data.
Right.
Then just ask yourself, in the role that they're going into, does that nature help them do their job better, or are they going to be fighting against it the entire time?
Right.
And then you add questions to your interview process to look around those corners, to shine the lights in the dark spots, to see, okay, how is this person going to handle these scenarios?
Yeah.
I think it is important, and that's part of the reason for the question. And when you give your answer of what would make me feel like this was a bad idea, and you describe the behavior, they're going to know if they line up to that behavior or not. And that's where you're going to see someone go, okay, well, this has been really great. I'll think about it and I'll get back to you, and you'll never hear from them again.
Right.
We love that. Go ahead, self-select out. And we want as
Yeah.
many people as possible to self-select out, because we want the people who are like, holy moly, like you're describing me. Like you
Yeah.
were, and no one's ever paid attention to that before. Actually, I've been that way everywhere I've ever worked, and no one's ever appreciated it. And you're telling me in advance that that's how you want me to be. That's the person you want in your organization.
I love that. Love that approach. And Zed, as we come up on time, I just want to make sure I get this out before we move on to the one of the last questions. I have the Physician Growth Accelerator site pulled up right now. And folks tuning in, there is a very quick and easy self-diagnostic tool, which I'll have listed in the episode description for you all to take and receive an instant score. It quickly identifies the symptoms that can be holding your practice's growth back. Zed, I love that. First, I love that you make that accessible to practices up front. And as those results come in to you, to your team, and as you begin these conversations, can you tell me some of the stuff we haven't touched on? What are some themes that come up amongst these practices as far as the symptoms go that you're seeing that maybe not related to hiring, maybe not related to, jumping the gun and potentially not being ready for that growth of 40, 50 new patients a week or month or whatever the number is?
Yeah, that's a really good question. The way we like to ask that question when we meet people is, what keeps you up at night?
Mhm.
And, the most common answer is uncertainty, because they feel like everything's okay as long as nothing breaks, but they don't really know why it's okay, and they don't really know what would break.
Right.
So it's a broad statement. It's typically related to income. It would be, I'd feel safer if it was higher.
Yeah.
I'm unsure about costs. I'm unsure what this looks like in a year or 2 years.
Mhm.
And that's why those feelings are never created by a single thing, right?
Right.
That goes back to that. It doesn't exist in a vacuum. So that's that simple symptom checker you're talking about. What it helps the person do is go, you know what? I've never thought about the fact that my team is defensive, but they are. And that's probably impacting everything.
Right.
Or I've never thought about how we communicate a treatment option to a patient. And if I'm actually worried about income, I don't know how we do. I don't know what percent of patients move forward with this treatment option. I don't know what the lifetime value of a patient is. So I don't know how much I should spend to drive that patient in. You know, we see this, this breaks my heart. When a practice wants new patients and they do some kind of advertising, and it was totally designed to fail in the beginning. And they have no idea because they're dealing with companies who are marketing and advertising companies, and it's literally their job to sell their services. Rarely do they see their job as to achieve an outcome.
Right.
And so we'll work with a practice and we'll say, okay, your target patient that you want, the lifetime value of that patient is, let's say, $1,000. That means you can't spend more than $300 to get that patient in. And by the way, you only have 5 slots a week to be able to bring this patient in right now. So that's only 20 slots a month. So 20 times 300 is the max you should be spending on advertising, because you can't spend more than $300 to get this patient type, and your system can't take more than 20 people.
Right.
And that's why it's so important to build it that way. And then you see the other mistake is they make advertising messaging around themselves. Like, we're this type of practice, we do these things, when in reality, you don't matter, the patient matters. You have to speak to the patient about what drives them. So that's a big one. And a lot of people have felt burnt dealing with marketing companies and media companies over the years. But there's so much opportunity to drive your ideal patients in that it's one of my most favorite aspects of, once you get your system down, create the capacity and then go fill it on purpose. But I would say, going back to your original question, it's related to income and uncertainty.
Yeah. And you're totally right. It's actually really sad when you think about it, because, you know, it's very simple for somebody to set up, let's say, Facebook advertising, and, click a few buttons, get an ad up, whether it's through an agency or paying someone on the side, what have you. Very, very easy. And there's some excitement around, hey, I can show your ad to about 5,000 people and in your neighborhood. Then there's of course the ones that are say, hey, we could put your ad in front of 1 million people. But those 1 million people, and sometimes even those 5,000 people in that region that is specific, I hope some of these agencies are working regionalized and honing in there. But it is truly sad. And you think about it, like, they're working on these impressions, these eyeballs, and the eyeballs don't matter. And it's not, as you mentioned, backed into capacity of the practice. It's not backed into the type of treatment they want to provide. And the list could go on and on. So it's really, really sad to see that. And I think what you also mentioned about, you've said it throughout the episode, this one and the first one, to back into data and knowing that capacity. If I only have 5 slots, let me fill these 5 slots and then I'm good. Or maybe it's time to think about another practice. So I love that you mentioned that. That is, I've seen many people get burned through agencies, and it is a truly difficult sight to see. So,
Well, I'll tell you a quick story, because
please do.
it really paints the picture. So that practice that I mentioned early on in the episode, where the procedure on average was 179 days.
Yeah.
So imagine that practice is advertising, and we uncover that the agency they hired to handle their Google AdWords was allowing the search to be clicked from the entire world. So here's a local practice. They're basically going to deal with patients within 15-mile radius for the most part.
Yeah.
And their big Google AdWord bill has barely anybody from their local area and people from countries I've never even heard of clicking on ads. Okay. So then you see that and you go, man, well, if we fix that, it'll work. No, because it's
Maybe.
179 days until you get a procedure. So any dollar amount you spend today, your return on investment, you can't witness it for 5 months if it's the greatest thing ever. So does that
Right.
make sense? Or should you bring the time in? Should you stop advertising, accelerate the time that someone can get this procedure done, and then start advertising? So it's just that's why I always it's never in a vacuum. It's never one thing. There's other stories where the ads worked great, but they went to a website and we uncovered that someone somehow forgot to put a phone number or a contact form on the website. So you go on the website and there's no way to contact the practice. Or another example where they wouldn't answer phone calls. So they were missing 67% of their inbound phone calls, and you're spending money on advertising. And all the metrics guys get to pat themselves on the back on, hey, advertising is pretty fancy. Look at this. We're doing
Yeah.
all this fancy stuff. You're seeing web traffic. It's like, oh, but you can't get a patient in. Well,
Right.
but we did our job, so it drives me nuts. But, when you understand the whole system and you can look at it, then it's almost like as a kid, I always enjoyed the books where it would show you the inside of an engine and you could
Right.
see all the pieces, because there's not just some magic box that you pour gasoline in and now your car moves. There's all these pieces, and you can lose efficiency at each piece. And that combined efficiency loss creates an outcome you don't like. But if you don't peel back the layers to see it, then you just think, well, I guess this is the way it's supposed to be.
Yeah. That's again, I've seen it so many times. Who do you sort of blame for that? Is we obviously have opinion about the agencies and the marketing teams and advertising agencies, driving impressions, driving whatever they promise. But can in your experience, what is the practice owner or the staff that you're working? What's their like reaction to that? Just those simple things that like should be in a process to check before any dollars are spent anywhere.
Yep.
What's their reaction like to that?
Oh, it's pretty brutal. But here's, you kind of leaned into the who gets the blame for this.
Yeah,
And to me, it's generality. Anytime we speak with generalities, you leave the doors wide open.
yeah,
So there is not a single practice on the planet that should be saying to themselves, I want to advertise. No, you don't. You don't want to advertise. You want the advertising to do something for you.
yeah,
So what is that? Well, I want more patients. No, you don't. What more do you want? Well, I want 30 more a month. No, you don't. What is wrong with those 30 people? What are they trying to achieve? You have to drill down into these defined specifics
mm,
so that if you're interviewing an agency, you can say, look, I don't care what metrics you look at or what report you send me in fancy colors in 97 pages of a PDF. Okay.
yeah.
I want 30 patients who are suffering from this specific disease state, and I need it to cost me this dollar amount a month.
Can you hit it? Yeah,
Can you hit it? Or can you show me that you're going to? Are you like, I understand that data is needed for leading indicators. So we need to look at web traffic. Did it go up? Did it go up with the right people? Are those people calling? Are the calls being answered? Are the answered calls turning into appointments? Are the appointments turning into procedures? But if the person just wants to, sit back in their chair with their arms back and go, well, I did my job,
yeah,
like, choose someone else.
yeah. The outcome is doomed right from the get. So
But generalities is to blame.
yeah.
Get specific. Your brain doesn't want to get specific. It'll even argue with this. Drives me nuts. I'm kind of going off a tangent here, but
No,
a
please.
business owner knows that they should be specific, but they'll challenge their own belief in what the specific number is, because they'll go, well, I don't know how to come up with a number. And so then they feel bad sharing this number with people as an expectation because they don't know how they got to it.
Right.
And we as leaders, we have to just push through that discomfort. We have to call a number. We have to say, this is why it's important. And then we have to be okay getting it wrong. I love when an indicator is showing me that we made a mistake. Like, that is the most powerful actionable information there is.
Yeah.
Imagine you get a patient, and I know there's a lot of different specialties out there, but imagine a patient is just absolutely miserable and every test in the world shows nothing. That's tough.
Yeah, of course.
So we need, yeah, right. So we need metrics that are telling us, hey, you screwed this up. Oh, good. Okay, sweet. Now we can go do something.
Yeah. It's that ability to just fail fast and be communicative. If we're talking agency to a practice, just fail fast and communicate that out and then make those shifts. I love that, Zed. And I appreciate you taking the time. I know we're up on time here, but before we wrap up, and I know you've shed a lot of light and a lot of insights, but I want to give you the floor one more time for just those closing thoughts on or growth hacks that we didn't touch on before we wrap up today.
Yeah, I think it really comes down to there's a framework that we teach our clients, and it's DCM. It's really, really simple. Define, communicate, measure. And I think the most powerful growth hacks are don't let your brain try to keep you comfortable with generalities. If you catch you or your team saying more, better, faster, worse, good, bad, stop. Yeah. Put some definitions around it and make sure everyone hears the definition. Communicate to the team and then measure. So if it's something as simple as let's get patients in within 5 business days, define what that means. All right. It means new patients. It means business days of, 5 times 24 hours. And it means patients dealing with this. And our current number is this. We went and did the math, and right now our average is 9 business days. We want to get it to 5. Does anyone have any questions on how we define 5 business days, how we define a new patient appointment? No, great. So now let's design failure. Make sure this doesn't happen. It's going to show us the glowing white path to follow. And then now let's measure what the outcome is every week. Well, what was our number? Well, we were still at 9. Okay, is there a reason why we were still at 9? Yeah, it turns out this. Great. Next week, we're at 7. Good. How did we drop from 9 to 7? Hey, we went up to 11. Okay, how did that happen? Define, communicate, measure. Everything is sitting in front of us because we are truly experiencing the perfect outcomes of our current systems. We have to dive into the system.
Love that. Awesome stuff, Zed. Thank you so much again for the insights, for taking the time. I've enjoyed this series. I know our teams have. I don't know the audience listened to episode 1 have. We've gotten nothing but positive feedback. I can't thank you enough, and I hope we could do it again real soon.
Happy to do so, Gary. Thanks.
Awesome. Looking forward to it. Folks, before we wrap up here, just a few reminders. I will have links to connect with Zed on LinkedIn, the Physician Growth Accelerator podcast, the website where you can do that self-assessment, and check it all out, dive deeper into ensuring the business side of your practice is healthy. And the first episode, of course, on this show with Zed, all in the description below. If you enjoyed the conversation, please be sure to like and subscribe to the Modern Practice Podcast on your favorite streaming channels or on rectanglehealth.com/podcasts. Thanks so much for tuning in. Till next time, everybody.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event details. Thanks for tuning in.